Hello everyone and welcome to my YouTube channel. My name is Mauricio Scarpello, as some of you know me. I'm an adolescent health doctor from Argentina, and today we're going to have an interview with Dr. Jonathan Klein, who is here with me. How are you, Jonathan?
Just fine. Thank you for having me, Mauricio.
Okay, thank you. I thank you for being here with me. Well, Jonathan, most known as for most of us who work in adolescent health and that we know him, we call him John in general. So if you let me, if I can tell you John, it's much better perhaps, or it's
Sure.
okay? Okay.
Sure. No, it's fine. It's fine.
Okay. Well, John is president of the International Association for Adolescent Health and also serves as a treasurer and as a member of the executive committee for the International Pediatric Association. He is based at the University of Illinois at Chicago, where he serves as associate as vice chancellor for research, and is the Savitri and Samuel Rach endowed professor and executive vice head or chair for the Department of Pediatrics. So too many words and knowledge you have had, yes, in all this time, and that's very, very good. So for some people to know where you are in the United States, and exactly where, can you tell the people where you work?
Sure. I'm in the United States in Chicago, which is a large city in the state of Illinois, which is in the, we call it the Midwest, but it's actually more towards the eastern half of the country. But it's right underneath the Great Lakes, which are very large lakes that separate the U.S. and Canada.
Exactly.
So we're at the north, we're as we call it, the north coast of the U.S.
So I imagine that it's very cold in winter, right?
It gets quite cold and it snows quite a bit in the winter, yes.
In the winter.
And Chicago is a city of, I think we're about 6 or 7 million people in Chicago these days.
Huge city. Okay, John, to start a little bit about the talk about these adolescent topics that we generally speak, I would like you to tell us or to describe how is adolescent healthcare in the United States or in the region where you live? I mean, for example, accessibility, if it is private, public, how is in general the adolescent health system there?
So I think to talk about the adolescent healthcare system, we really need to talk about the United States healthcare system overall. And we have a primary care system, which mostly is delivered by physicians, by both pediatricians and family physicians, and also by internal medicine adult docs. We also have nurse practitioners who deliver direct care. But most people get their care from a primary care physician. And that could be in a community-based private practice setting. It could be in a community health center or a public setting, or it could be in a hospital-based clinic. People practice in all different models of care. As for adolescent medicine, most adolescents get their care from a pediatric or a family physician, primary care physician. And most of us who do adolescent medicine as a specialty are involved in care for adolescents, either in special adolescent clinics or are involved in the education of primary care clinicians. So, for example, at our medical school at the University of Illinois at Chicago, we have a pediatric clinic. We have an adolescent part of the pediatric primary care practice. We train residents, we train fellows in adolescent medicine to deliver good adolescent care as part of their routine education in pediatrics.
That is in.
We also have a family medicine.
So sorry,
I'm sorry, go ahead.
that is when they are doing the residency of pediatrics, or is undergraduate, or is it fellowship?
Both medical students and residents come through the teaching part of the program. And those of us who are adolescent medicine specialists see adolescents both in that primary care setting, and then also have a special focus on specialty care for adolescents. So we also will get referrals for eating disorders, for behavioral problems, for reproductive health or contraception. And so we have a focused clinic that has referral availability, so that if primary care doctors in the community have an adolescent with a problem that really needs specialty attention, they can send them to us. And so our practice, and this is true for most of the academic medical centers, the adolescent practice is both a specialty practice and a primary care practice.
I see. And do you have like limits of age for consultation or for working in adolescents there?
There's no absolute limit. It's a lot of it depends on the individual teenager and their needs. Mm-hmm. So that many of the adolescent practices in the U.S. will follow their adolescents up until the young adult years, into the early 20s or even to mid 20s in some cases. I would say most adolescent practices would pass their patients along and go through a transition, if not at the entry to university college years, then certainly by the end of that. So somewhere between 18 and 22 or 24 would be a typical time of transition.
So there, for example, it's like hospitals or clinic are parts of universities. It's not that these are hospitals, for example, separate from universities. It's like that. I mean, it's always like part of it.
Well, our health system is a little bit complicated and a little bit crazy. So a hospital can be part of a university and part of a teaching center, like in a medical school or other health science schools, or the hospital can be a freestanding hospital with clinics in the hospital as well. In general, the private hospitals that are not part of university or academic medical center systems tend not to have the same density of clinics, of outpatient clinics. They're more likely to have a relationship with community clinics and community primary care and specialty care, but that depends on where, and certainly there are large hospital systems that are not medical school based, but that are serving very large geographic areas in some of our states that also have the specialists, on site for the convenience of both the families and the primary care folks in their communities.
And for example, if an adolescent wants to go with an adolescent specialist, they can go themselves, or they have to go first to the pediatrician or first to a general physician. I mean, how is the accessibility to the service of adolescent health?
So that depends a lot on the kind of health insurance that adolescent might have, and also to some degree the nature of the reason that they want to go. So some of our health insurance lets you go to whoever you want to. Some of our health insurance is managed as part of a health maintenance organization or another form of a care organization, where you pick a primary care person and they have to approve your use of any specialty care. And so you have to meet the criteria for the specialty referral. But we also have in in most of our states, and this is it varies by individual state law, adolescents can seek care on their own if they have a need that fits into certain categories. So for most states, if it's pregnancy related, if it's sexually transmitted diseases, if it's mental health, if it's substance use, drug use, or if it's abuse, then adolescents can get access to care without any barrier, and that can be at any place that's able to provide it. That isn't true in every state.
Yeah.
And we have a real issue lately with some of our states and reproductive care, for example.
Okay. And what happens, for example, here in Latin America, there's some percentage of adolescents, depends on the country and the city and all that perhaps their parents have work and they can have an insurance for health, but there are another quantity of adolescents that they don't have any type of insurance. And for example, here in Latin America, when they don't have it, they go to the public system for consultation. In these type of things, what happens there, for example, in the United States? Do everyone have insurance? Or what happens with the adolescents that they don't have insurance? What do they do?
So, unfortunately, not everybody has insurance, and therefore not everybody has access to the care they need in the U.S. We know that adolescents and young adults are the least likely to have insurance, so that if they have insurance through their parents, that's good and it gives them better access. And in fact, one of the things that was done under President Obama when they passed the Affordable Care Act is they allowed everyone to stay on a parent's insurance policy up through age 26. So that it addressed some of that financial access for older adolescents and young adults. If people don't have insurance, they can qualify, if they're poor enough, they can qualify for the public insurance called Medicaid in the US, which then gives them insurance. And if they're not very, very poor, but are poor, they can also get health plans at a discount or with a subsidy from the government. But we still have some who are not insured at all. And there are some clinics that will care for all patients, regardless of their ability to pay. But most of those are public facilities, similar to what you said about Argentina.
I see. And what happens, for example, with the adolescent health professionals? Are they recognized by the public or the I don't know, the College of Doctors? I don't know how do you call it?
So I would say the adolescent specialists are pretty much not recognized by the public until somebody comes across really needing one for a specialty. They are recognized by the profession. We have a certification process that is run by the American Board of Medical Specialties, and the American Boards of Medical Specialties have individual boards for different specialties. So there's an American Board of Pediatrics, there's an American Board of Family Medicine, there's an American Board of Internal Medicine, of OBGYN, et cetera. Adolescent medicine is recognized as a subspecialty by the American Board of Pediatrics, Family Medicine, and Internal Medicine. So in fact, any of those three primary specialties can do special training in adolescent health and be recognized as a specialist and board certified as a specialist in adolescent health. That's important because in the requirements for pediatric training programs. So again, this is a different certification process, but the graduate medical education certification requires an adolescent medicine experience for pediatric trainees and for family medicine trainees. And the pediatric guidelines require that be supervised by someone who is board certified in adolescent medicine. So the profession is recognized that there's a special expertise in understanding how to care for adolescents and how to work with families and how to provide good quality confidential care. From the profession's perspective in adolescent medicine, it's good that it's been recognized because it recognizes that there's a role within training programs that adolescent health experts should be filling. And so that is very helpful in having our medical schools and our residency training programs include adolescent health in their curriculum.
I see. And a little bit introducing a little bit with the organization in which you are president. I would like to highlight, because this is very important in the whole world on some regions, this networking with all professionals in different areas. For example, here in Latin America, we have some organizations like CODAGIC or ALAPE in pediatrics, and there are some others, surely. Or even in our countries, our own countries. For example, here in Argentina, we have the Adolescent Health Society or the Society of Pediatrics, that we have like a special chapter committee for that, for adolescent health. And what is your point of view about this network, of professionals all over?
So I think it's very important that we have these networks and the national and regional societies. So the International Association for Adolescent Health, as you know, because you're our Latin American vice president, is a multidisciplinary organization of adolescent health experts and folks who are involved in clinical care or research or advocacy around adolescents and youth and their healthcare. And so IAAH, as we call it, also is a network of the national and the regional societies around the world that have a focus on the adolescents in their countries or in their regions. And what we try to do is to make sure that there's an opportunity for people to connect and know each other's work and have the tools and the resources to advocate for the adolescent health workforce and for adequate training for frontline primary care, health care to include adolescent health, and to be able to advocate for involvement of young people in speaking for their own needs, both young professionals and youth directly, and to support advocacy around adequate systems and good quality of care with some of the global agencies, with UNICEF and WHO and the other UN agencies. And so, one of the things about IAAH that's very important and powerful there is that it is multidisciplinary. We have psychologists, we have researchers, we have nurse leaders, we have physician leaders, we have public health leaders. It's not just the pediatricians, because in some countries, the pediatricians do a lot of the adolescent workforce work, but in many countries, it's the general practitioner or the community health officers or the public health system. It also is a way for us to relate to those other primary care organizations. And so IAAH is a member of the International Pediatric Association as a global specialty society. IAAH is a small organization. We have, a few hundred active members. We have a couple of dozen national and regional societies that are engaged in working with IAAH. The IPA, the International Pediatric Association, or IPA, as folks will say in Latin America, is about 1 million pediatricians caring for almost 2 billion children. And so the national pediatric societies and the regional pediatric societies like IAAH are much stronger in their ability to advocate. And as a global specialty society, our ability to bring adolescent health issues to a group like IPA magnifies our voice and helps us connect our national adolescent health leaders to the broader agenda of improving care for children and youth and families. Go ahead. You were going to ask a question.
Yes, no, I was going to add, all these about this type of organizations that most of some regional or national associations are part of even bigger associations like the IAAH. And in this topic, I would like to add also that it's very important for all the professionals that are working with adolescent health to be part of this network, because perhaps there are many people that are working by their own, and sometimes they have doubts or they want to share experiences, or even they want to know about congresses. For example, the IAAH makes the World Congress. Can you tell us a little bit about that?
So our last World Congress was in 2021 in Peru, in Lima. But of course it was COVID. And so that wound up being a virtual Congress. Currently this year, there have been a series of meetings in some of the regional organizations. So the Caribbean meeting is happening starting tomorrow through this coming weekend in Jamaica. The European Regional Adolescent IAAH meeting took place in Athens in Greece about 3 weeks ago. And there was a regional meeting back in Lima as part of the celebration of the 25th anniversary of the Society for Peruvian Adolescents and Youth that we were both at a few weeks before that. The next global Congress will be most likely in 2024. And the final negotiations about where that will be and what time of year it will be remain to be settled. So I can't tell you where it is yet, but I'm hopeful that we'll be able to say that soon. Between now and then, as you know, we'll also have a Latin American Congress that CODAHEC will be sponsoring. I think, what is that, next November?
In November 2023 in Costa Rica, exactly, yes.
Exactly.
Yes.
Exactly.
And these are very special moments to share, to know more people, to make this networking. It's excellent.
Yeah.
Yeah.
I think the other meeting that is an annual meeting is the North American Society for Adolescent Health and Medicine, which is primarily U.S. and Canadian in its membership, has a large meeting every year. And they are actually meeting in March this coming year. It was going to be in Baltimore. They've now moved that meeting to Chicago, so we'll have them here in Chicago. And that's also a time when people can come together and have a chance to learn from each other when it comes to what's happening in the field and what might they want to bring back to their practices or share.
And I also wanted to ask you about, what do you think about the role of the IAAH in terms of, for example, positioning? Sometimes there are like statements or position statements about topics or about things. What do you think it is like the importance of the IAAH, for example, doing position statements or papers like for advocacy for adolescent health or things like this?
I think in areas where we have the ability to look at the evidence and come up with some specific recommendations and guidelines, that it makes a lot of sense to try to identify positions and policies that should apply to all countries. And so I think when it's something that IAAH has the ability to review and come up with a position, it's reasonable to look at how do we get that out into the literature, and how do we share that with people appropriately? I think the challenge with policy statements is making sure there's a place to publish them, because if you write them and then nobody reads them, it doesn't help very much.
Exactly. Yes, exactly.
But it can help people in their advocacy in their own country to be able to say, this is the global standard, and here's why, and here's the evidence, and how are we going to make a commitment in our society? And I think if you look at some of the on October 28th, the Partnership for Maternal Child Health, PMNCH, which is actually a partnership for women, children, and adolescents health, will be launching a call to action for adolescent well-being. IAAH is a partner in that call to action. And if you look at the what's missing in care systems, a lot of times it's the adolescents. And so thinking about how investing in adolescent health systems and education systems not only address adolescent well-being, but also address those adolescents' children and address their future adult health and chronic illness. It's really an opportunity to recognize that if we want to achieve other global goals for health, we need to be investing in adolescents as well. So I think that will be an opportunity for IAAH to help spread that word and to address what needs to be done to really bring adolescents to a better state of health.
And also, I think it is very important in terms of, for example, nations or Ministry of Health system that want to make contact with the IAAH for mentoring, for advice, or for things that perhaps may be of help, like a different point of view. And I think that there is something that is very interesting of the IAAH is that there are members from all over the world. So that makes like a very, very nice view of the adolescents, because sometimes, as you were saying, when we make a position statement or something, like we think about the adolescents we have near us, like where we live, but the International Association for Adolescent Health thinks more, thinks for the entire world. So perhaps each country can adapt or can think of the specific things or specific ethnicity or something about their regions, but it's very interesting, this global thinking in the IAAH. And one last question that I wanted to ask you, that I think it's also a very important part of the IAAH, is the Young Professional Network. Because that's the future of the adolescent health in a way. And if you can tell us what it is about, to tell the people what it is about the Young Professional Network.
Sure. Yeah, no, we're very proud of the YPN, or Young Professionals Network. The YPN is only about 3 years old, but we have a member of the YPN sitting on our council, so that we've got adolescent leadership in the room when we talk about adolescent health and policy. The YPN also has its own leadership and a very active committee structure addressing education and advocacy and several other topic areas. We put a lot of time into helping the young professionals organize themselves in anticipation of the Congress in Peru. We had over 400 of them at that Congress. And it's been a very, very active group of young professionals who work in adolescent health settings, both as clinicians and as researchers. And so I think you're exactly right that they are the future of our profession. And it's a really important part of our commitment as IAAH to make sure that we're really supporting and investing in the younger professionals so that they are able to be effective in linking up with the older folks in their own countries, but also able to have a say in policies that affect them and that affect the young people that they care for.
Be careful. John, I would like to thank you about this time that you have spent with us, and probably perhaps this video is going to be seen mainly in Latin America or perhaps other countries too. I would like everyone to comment below if you want to ask like more questions or perhaps for future videos, and to let everyone know that there is a webpage for the IAAH. If you want to say, John, the direction of it's www.
WWIAAH.org.
ORG, exactly.
And the Google Translate will allow you to read the web page in English, Spanish, French. What else? I think
yes, I think German too. I'm not sure.
Arabic, Chinese, and all the UN languages. I think.
Exactly.
So please take a look at the website. Follow us on social media in Facebook and Twitter, and please follow us and watch for the opportunity to come to the meeting in Costa Rica in November 2023.
2023.
The meeting in Peru was fully translated in inglés y español, y pienso de Costa Rica lo mismo.
Excellent, very good. We are going to practice. Okay, everyone, thank you for being here with us and listening to this interview, and we are going to see everyone in future videos. Bye-bye, everyone. Bye-bye.
Thank you. Have a good
Bye-bye.
night.
Bye-bye.